Hey, and on This Week in Pharmacy, in the studio with me, I have a special guest. Dr. Mark Fulton is here from SoftWriters. I'm glad that you could meet me down here at the Brownsville studios and talk shop.
Oh, Todd, it's my pleasure. I love coming to the studio here. It is one of the coolest parts of my job. I love being able to talk about pharmacy, and it's great being able to speak to it here on the podcast, here on TWIRx, because this audience is in the know. This is an audience of people who are in pharmacy, people who are pharmacy adjacent. If you care about this profession half as much as myself or Todd does, I know you're a listener. And if you know, you know. And it's so great when you're talking to people who have kind of walked in that vein, who have lived that life.
Absolutely. So that's the reason for This Week in Pharmacy. We want to highlight people in the industry that are doing things on a multiple facets. We've talked about clinical trials. We've talked about digital therapeutics, long-term care, geriatric care, pediatrics. We have an ongoing show that's the Pediatric Pharmacist Review that's doing really well. But today I want to welcome Danielle Greer, who is actually a member of the SoftWriters team. And we met actually at the AI User Conference, which was the first artificial intelligence user conference dedicated to long-term care pharmacy. Danielle, welcome to the show.
Hi, thank you. Glad to be here.
Absolutely. So right out of the gate, talk to our listeners. Tell them a little bit about your background. How'd you get involved in long-term care pharmacy technology?
Oh, yeah, I go way back. So I started out my career working in assisted living and doing medication management. And I was down in Texas at the time. And I started in remote automated dispensing. We kind of introduced the first of that technology to the industry, where we were installing big machines directly into nursing homes and assisted livings to dispense medication real time. And that's kind of where I picked up my love of technology and the industry altogether, and how technology could benefit and move it forward. And fast forward from, I guess, the early 90s to now, and here we are talking now about how we can inject some artificial intelligence and bring it even further.
That's right. So talk to us about that. Like, what application do you see fitting into long-term care pharmacy technology in how AI could be utilized today?
Yeah, I see. Yeah, long-term care pharmacy is experiencing a remarkable period of transformation, and it's being driven by technology. And it's being driven by a couple of the top pain points that we actually surfaced during that AI Mastermind series that we had back in May. A couple of the points that they're struggling with nowadays are really in staffing and operational efficiency. And everyone is really craving automation, and the applications in AI that we see that have the most value that we're looking to integrate into our core products can do just that: automate some of those redundant workflows and help reduce, the stress and strain of having to add staff, and make those more efficient for the pharmacies. So that's where I see AI, and that's where we're looking right now, is how we can make the operation more efficient.
Mark, when we were at the user group gathering it was a mastermind of long-term care pharmacy operators, and there was so much participation and energy down there. People were excited about this discussion. What did you hear from the people that were the clients that were there of SoftWriters and using Framework LTC? Where were they leaning with the ideas of how AI was going to fit into long-term care pharmacy operations?
That's really great. Thanks for asking me, Todd. The AI Mastermind Summit was a fantastic event. We had some of the top minds and some of the real leaders in long-term care pharmacy today come together in one place. They all met in Pittsburgh. And what we did at SoftWriters is we did a lot of listening. We really listened to our customers and helped to show them, here's what we know about AI right now. Here's what we're thinking, but we want to know your opinion. We want to know, okay, of all the things we can do, what should we do? What's the right thing? And the things that they really stressed to us were, I don't think unique to long-term care. These are things that are top of mind for all pharmacies across the country. Mm-hmm. But like Danielle said, their pain points were operational efficiency, trying to do more work with the same amount of people, also trying to eliminate a lot of those redundant tasks, right? The things that, hey, we could automate this to free me up to, do more things that require a human being, right? We also learned about some of their hopes and fears. We learned what they hope that AI can do for them, as well as what their concerns are, right? Because as a technology firm, we need to balance what's possible with what's ethical and responsible.
That's an important point, Mark, because that's something that we wanted to get from this mastermind series as well, is what the risk tolerance is, right, in this industry, because we understand we have a huge responsibility to patient care and safety, and we want to come with solutions that are safety top of mind. It's all about efficiency, but for us, we want to make sure that we can also do it at the utmost patient care and safety.
That's the whole purpose of our pharmacists throughout the nation, the 300,000 plus active pharmacists that are out there. Number one reason for their existence is to keep our public safe, keep their patients safe, and really being able to maximize the effectiveness and the optimal usage of medications, and then the knowledge of what you know around a specific condition or disease state, whether that you're going through a senior that's suffering with dementia, or something that might be a memory game. There is a new dementia exercise memory game coming out that's going to be a digital therapeutic that's going to plug into some of the therapies that are coming out. And actually on TWIRx, we're not allowed to talk about it yet, but it is coming as a show in digital therapeutics. So I'm excited about that. Danielle, today's episode of TWIRx is brought to you by the 14th annual Framework LTC User Conference this October at the area in Las Vegas. Can you give our listeners just a little snippet of what's going to be happening in October?
Yes, I'm thrilled to discuss our upcoming user conference. In my opinion, the energetic theme this year is around accelerating innovation in our industry. And my perspective is it's never been a more exciting time to be a SoftWriters customer. We've spent a lot of time dedicated this year to engaging with the customer, the AI cohort, and the conference is just the biggest platform to be able to do that in. And we're excited that we're going to be able to debut some of the things that we've been working on this year, as well as speak to what our roadmap looks like going into next year. There's opportunity to learn how to use our software better to capitalize on those efficiencies. And it's just a great time for us to be able to get face time with our customers.
Well, I'm excited about it. You guys put on an amazing event. We got to be a part of it last year, and there was a ton of excitement there, lots of interaction. What I like about the user conference that Framework LTC, that the SoftWriters team puts on, is the interaction. Even when people are up on stage, they're interacting with the audience, and I like that. I like not just having to sit there and listen to a one-way presentation, but it's almost a multi-part sharing presentation, and I've always appreciated that. What are you looking forward to at the next conference, Mark?
Well, I really want to double click on that for a moment, Todd, because you brought up how our customers aren't just attendees at the conference; they are part of the events.
Yep.
We do a lot of panels. We do a lot of discussions. We give our customers and our industry partners the opportunity to co-present, to serve on panels, and to have a discussion that can be heard about the most important topics that are facing long-term care pharmacies today, to get the expert opinions of the people who are out there in the field, the people who are running these businesses. Personally, the thing I look forward to most, as Danielle said, is our terrific customers. We have some of the best customers out there. These are some of the top operators in long-term care today. These are folks who are innovative, people who are really creating the next generation of closed-door long-term care pharmacy and broadening what that looks like in the US. I'm really excited for that. And also not just our customers, but our industry partners.
Yep.
We have a lot of vendors, we have a lot of suppliers, and a lot of adjacent organizations that we work with in order to not just maximize the value of what we offer as a software company, but also to help provide the full breadth of services and products that our customers need in order to be successful.
Yep. Well, we're excited. SoftWriters has been a big supporter of our advancement of our publication, specifically content around long-term care pharmacy. If you're a long-term care pharmacist, if you're a long-term care pharmacy, and you want to learn more about SoftWriters, please check them out at softwriters.com. Once again, that's softwriters.com. When you go there, you'll be able to actually link to the registration event for the 14th annual user group conference, Framework LTC user conference. Danielle, thank you for being our guest today on TWIRx. And we have to have you back and dig into some of the things that your clients and customers are helping to build out through artificial intelligence.
Thank you for having me.
Thank you. All right, and closing up the show, Mark, I just wanted to thank you for coming down to the studio and for being a part of TWIRx, and we can't wait to have you back.
Oh, thanks so much, Todd. It's my pleasure. I also want to thank Danielle. Danielle is also my boss. So, and don't let her fool you. When she comes back, she has a fantastic resume. She has some great stories from her career in roles that you would never guess. And it amazes me every time when I get to learn about someone's background like that. So again, thrilled to be here, and I'll be thrilled to be back.
Absolutely. And once again, if you are in long-term care pharmacy, reach out to us. We'd like to learn about the success that you're experiencing or something that you're dealing with right now that we might be able to help. This podcast is going out to thousands of listeners. So we know that the ideas to help move our industry forward are coming from you, the listeners, the pharmacists, the operators, the pharmacy technicians. To reach out to Pharmacy Podcast Network, and we're going to get you plugged in. Thank you for listening to TWIRx.